Hi, how many of you know someone struggling with a severe allergy? How does it take a toll on their daily lives? Well, we are the EpinephBAND team bringing you the new solution to living with allergies. The problem is that for children, elderly, and disabled, especially, self-injection is not always possible during an allergic reaction. Severe allergic reactions create extremely high-stress environments, making it difficult for individuals experiencing anaphylactic shock to safely inject themselves. For example, Stuart's father is very allergic to bees. One day, he went hiking up a mountain, and he was stung by a bee. While he was panicking, he grabbed an EpiPen to use on himself, but he was holding it upside down. The needle ended up going through his thumb, and no epinephrine was administered. He ended up needing to go to the hospital to get treatment, which isn't quite ideal. Although he survived, this shows that when someone is in a stressful situation, they might not have that full ability they usually would to perform tasks such as administering an EpiPen injection by themselves. Anaphylaxis is also a serious medical condition that could lead to death if left untreated. Allergy fear can also affect people's daily lives. For example, someone like Stuart's father, who's allergic to bees, may not want to go outside alone anymore. Currently, there are upwards of 50 million Americans suffering from allergies. We talked to Dr. DeWild, a professional with experience in biosensors here at UMass Lowell. We discussed that parents want to send their children off to school safely without fearing emergencies. Time is crucial when an allergic reaction is taking place, and there's many ways for the injection to go wrong. She mentioned to us that her niece and herself would both directly benefit from a device like ours because it takes a preventative approach to allergies and takes the relief off the person having the reaction. Since 2005, food allergies especially have been increasing amongst the population, hence the graph pictured. The closest thing out there right now on the market is the AviQ, an EpiPen that also speaks to you. However, this device still forces the user to self-insert the needle. EpiPens and AviQs are still extremely unnecessarily expensive. A pack of 2 AviQs would cost $5,100, a steep price for something unavoidable and uncontrollable. The medicine we decided to focus on delivering is epinephrine for allergies. Our device will be able to automatically test for a yes or no of an allergic reaction. The EpinephBAND takes away that stress and anxiety related to self-injections. We're currently working in the prototyping phase of our project. Over time, we're going to work to use the same system for other applications such as immunotherapy, hormone therapy, or insulin treatment. However, our goal for right now is to create an all-new platform for drug administration. Our device will save lives and give those suffering from diseases or imbalances the freedom they want to live their life unaffected by their medical problems. Our proposed solution combines histamine biosensors, automated drug administration, and Bluetooth connectivity to detect, treat, and get help for individuals experiencing severe allergic reactions. Our solution is unique because there's no other device that will automatically detect an allergic reaction and then deliver the epinephrine into the bloodstream. In order to implement our project, we'll need roughly $250 to create an initial proof of concept prototype. This will cover the cost of the Arduino, Bluetooth module, histamine sensors, and general materials required to build a functional model. To cover all initial costs, we would need an additional $5,000 to $6,000 for other things like app design, research, and intellectual property. We'll use these funds to design a model ready for mass production, certify that our product is safe and effective, purchase a patent license to protect our intellectual property, and get our first samples of the final product for demonstration and advertising purposes. Our team meets roughly 3 times a week for several hours at a time. We've met in person with interviewees and professionals across the state and the field to conduct our preliminary research. The designs for our first prototype are currently being finalized, and a working model will be ready soon. We are eager to move towards our final functioning product once funding becomes available. In the future, we would need further resources to cover legal fees and FDA approval, advertising, establishing business partners, opening a facility, hiring staff, creating an injection mold, and large-scale manufacturing and shipping. Thank you for listening, and feel free to contact us with any questions. Recently, a study by Gupta and Pandey concluded that using histamine biosensors in dead fish was successful. In the presence of a DAO, which is diamine oxidase enzyme, a chemical reaction takes place that releases measurable quantities of another chemical substance. A study by Cash K.J. and Clark H.A. on phosphorescent nanosensors for in vivo tracking of histamine levels concluded that the same DOA enzyme can be applied to humans. Epinephrine prevents obstruction to airflow during anaphylaxis, and it also reverses the effect of cardiovascular collapse. In our research, we found a study online involving histamine biosensors. This led us to further research by asking to administer an in-person interview for use in our project. We ended up going to Northeastern University and speaking with Dr. Eisen Calderon, a postdoctoral for Dr. Heather Clark at the Clark Lab at Northeastern. Dr. Calderon has ample experience working with different dyes for different sensors. We discussed the options for our histamine sensor and found that we needed to either use an oxygen-sensitive dye or a pH-sensitive dye. By using fluorescence, we should be able to detect whether there is enough histamine in the bloodstream to be considered an anaphylaxis. Because our device is only testing for a yes or a no, the mechanism could actually end up working very well. The researchers incorporated PLGA, a biodegradable plastic, in vivo. However, it would be easier to pass the FDA verification with an ex vivo device. Microfluidics were also discussed as a good application to our device. In microfluidics, small channels are controlled like switches in order to allow for different diagnoses and measures of chemicals.